I've been talking with doctors. I've been talking with people in the industry, in the healthcare industry, even some in the insurance industry. I'm going to bring on my next guest. His name is Dr. Rohrich. He is a purveyor of NavigateYourBeauty.com. He's the chairman of the Department of Plastic Surgery at UT Southwestern Medical Center in Texas. Dr. Rohrich is the co-author of the book Navigate Your Beauty: Smart and Safe Plastic Surgery Solutions. Doc, welcome to the Chris Salcedo Show.
Good to be on with you, Chris.
What was curious to me is, we've talked about how Obamacare is affecting those with in the general practitioner's realm, the everyday aches and pains, the folks who need surgeries and that kind of thing. What nobody seems to have been focused on is the elective surgery side of this thing, and it's something, frankly, I'm not really aware of the impacts Obamacare is having on the elective surgery side. So give me some feedback. What is it you're noticing so far?
Well, Chris, the whole thing about the Affordable Health Care Act or the Obamacare is that we really don't know. There's so many unknowns, and that's what, as a physician, that's a real challenge for us. We don't know, certainly, that we didn't address the lack of physicians, the physician shortage in this country, the lack of tort reform in the Act, and, of course, the failure to replace the sustainable growth rate, which is key to allowing more physicians to see this expanded group of patients, which we all care about, so they can get better care. So we're advocates for our patients, but there's so many unknowns. And in elective surgery, including anything from getting your pacemaker to having cosmetic surgery, it's just a big unknown. We do know that there's more taxes on those things. Medical devices are taxed now 2.3% more, so that's a challenge for patients undergoing elective surgery because most of that is passed on to the patient. So this book really addresses how people can actually be smart and safe when choosing elective surgery, and in this case, cosmetic surgery.
Let's, when I said that elective surgery, it would have an impact on this side of the equation, I didn't mean to indicate that, when everybody thinks of plastic surgery, you think of somebody getting their nose done or a nip and a tuck here. But there's also that side of plastic surgery, let's say for burn victims, where what I'm afraid of is that Obamacare will come in and say, well, you know what, we're going to cover you surviving, just enough to get you to survive. But as far as plastic surgery is concerned, about making yourself more presentable or maybe correcting some of the damage done by, let's say, a burn or something horrific happening, some malady that strikes you, that Obamacare is going to say, that's not necessary, that's not needed because we need to regulate and we need to, this is the whole death panel conversation. But it also affects those people who want to be made whole again, does it not?
Well, right. Well, of course. And, most of plastic surgery is, just like you said, Chris, it's reconstructive surgery. It's to restore to normal, not just to improve on normal. And it is so hard enough today to get insurance coverage for reconstructive surgery, for making people whole again after breast cancer, restore their breast to restore their face after burn surgery. And so, if anything, the complexity of this new Health Care Act is going to make things more cumbersome because what's happening is that it's making it more cumbersome for the physicians, the hospitals, to be able to not only afford it, but be able to do it in many of these settings. So the whole healthcare arena is changing so much.
Sure. The name of the book is Navigate Your Beauty: Smart and Safe Plastic Surgery Solutions. Also the purveyor of NavigateYourBeauty.com. My guest is Dr. Rod Rohrich. How many years have you been in practice, Doc?
I've been in practice over 25 years in Dallas, Texas.
Okay, so if you were a betting man, if you're from what the changes that you have seen coming down the pike from Obamacare and from what you've been able to glean from what we're told that Obamacare entails, because don't forget, folks, this law is being written by thousands and thousands and thousands of pages every single month by the administration, because a lot of it was left to bureaucrats to write. If you were a betting man, do you think that Obamacare is going to have a positive influence on your practice or a negative influence?
Well, I think as a physician who takes care of a lot of patients and physicians in general, we're very nervous because there's so many unknowns. Overall, I think many of my colleagues think it's going to potentially have a negative effect on health care for our patients. We just don't know. I mean, that's what's so amazing about this Health Care Act, is that in medicine we like to deal with the known. And so when we talk about what's unknown or what's changing every day, that's a little worrisome to us and to our patients. I'll bet.
As I articulated before I brought you on, we've been seeing a lot of doctors saying, get rid of the insurance companies, get rid of Obamacare. We're gonna come together and we're gonna provide direct point of service to the people, bypassing all of this stuff and trying to make it affordable. it may be where we're headed, where we have two classes of medicine in the country, one for the government, the other for folks who have more than two pennies to rub together. Dr. Rod Rohrich, he is the purveyor of NavigateYourBeauty.com. The book is called Navigate Your Beauty, Smart and Safe Plastic Surgery Solutions. Doc, appreciate your time on a Saturday here on the Salcedo Show.
It's my pleasure. Thank you so much, Chris.
Talk to you again.